kids, I was explaining you about tonsils. They are small organs at the back of the throat. I said you that when you go to a doctor, the doctor checks with a stick, okay? He put that sticks onto your tongue and see that whether those small balls inside your throat, those are infected or not. How? By seeing the white spots on the tonsils. And those are called as tonsillitis. That infection is called as tonsillitis. Okay, again, BLTS or LBTS, L, lymph node, lymph vessel, B, bone marrow, T for, what did I just explain to you? T for tonsils, and T for thymus, and S for spleen. What is thymus? Thymus is an organ in the chest. This is in the chest, remember, girls, where some white blood cells go to finish developing. There's a place where white blood cells stop developing. Okay, just know that. That's enough. What is a spleen? It's the largest lymph. This is the important most information here, that the spleen is the largest lymphatic organ. In all the lymphatic organs, what were the different lymphatic organs? Lymph nodes, lymph vessels, bone marrow, T for thymus, T for what was that? Just I explained you. T for thymus, and T for here goes there. Tonsils, yes. So, and the final one is spleen. That is the largest one. Okay, and it stores white blood cells and allow them to mature. It stores inside the white blood cells, but let them mature there. Let them be better there. As blood flows through the spleen, white blood cells attack or mark the body. This is where they attack the bacteria. Okay, they increase, the white blood cells become more there, they become mature, and as the blood flows, they attack the bacteria which was there in the blood. You understand? Like example, there is a car carrying blood, okay, and on the way it meets something which kills the bacteria inside the blood. Similarly, same thing here happens. The blood is flowing, the spleen is standing there. As the blood reaches the spleen, the white blood cells inside, they attack the pathogens or the bacteria in the blood. I hope you understood. Next, I told you about tonsils. I explained you about thymus, the spleen. What are some disorders of lymphatic system? What happens if this lymphatic system is affected, if it doesn't work properly? It's called as lymphoma. Girls, this is a very, very, very dangerous disease. Okay, it's a cancer. It's a type of cancer that often begins in a lymph node. It can cause a swelling in the node called a tumor. This node swells and it's called a tumor. There are many different types of lymphomas. Another disorder of lymph system is lymphedema. Lymphedema is a swelling of body tissues. Okay, this was swelling of the node. Here, lymphedema is swelling of the body tissues. First one I spoke was about cancer. That was very, very dangerous. This one is swelling of body tissues. Maybe there is some injury. Maybe you fell and there's a rash on your hand. It's about tissues. Lymph vessels are unable to drain lymph from certain area, and that area becomes swollen. They are no more allowed to drain, what do I say? Then drain lymph from a certain area, and that becomes swollen. So lymphoma was one of the disorder. Lymphedema was the other disorder. Filariasis or filariasis is a disease caused by thread-like worms called nematodes. Okay, they enter in the lymphatic vessels and block them. These are some kind of, you can see that, thread-like worms. They enter inside and they're called as nematodes. They enter inside the lymphatic vessels and they block them. And the lymph cannot move. You know that lymph is moving. Okay? The bacteria can enter the body through the bite of an infected flea. The bacteria grow inside lymph nodes, causing nodes to swell. A person gets infected with the filarial worms by being bitten by an infected fly. Filariasis is rare in the United States, but it's common in developing countries because of hygiene. They're talking about hygiene. Yeah. So this is what you need to know. Please highlight them. I will continue from bubonic plague in my next class. And so far now, inshallah dear, I will give you